So this case is about zirconia crowns versus Emax veneers. So the patient applied to our clinic with a sheath complaint. She was not pleasant with her smile. She had already upper 6 teeth was zirconia crown, which has been done 8 years ago. From my side, this smile looks natural as a color-wise, and the matching the color with the natural teeth, it looks natural. When you look at it, you don't spot actually these are zirconia crowns. But the patient told me, psychologically, I have always feeling that I have something artificial in my mouth. And I don't like this feeling. I would like to replace them with something more thin, natural looking, and also as a feeling, I want to feel like these are my own teeth. And also, in the same time, one of the main complaints was her gums was visible on the upper lower back left and right side. On the left side was slowly lower than the right side. And she said, I want something perfect, as a gum-wise, as a teeth-wise. And she said, I want beautiful smile. I said, could you please describe me the beautiful? And she said, I want white but natural smile, which is matching with my face. As you are master, you should know what will be good for my face. I listened her carefully. We start with the first session, which is trimming of the gums on the upper left and right side to harmonize the gum levels. And then in the same time, as you can see here, lower left backward, there's a one teeth already had crown, but the crown couldn't resist on the bite forces and then fractured and disappeared. And then we needed to reinforce this area. So we did with the post core and the filling reinforce the core of the old crown. And also in this stage, we take an impression from patients and the pictures and the videos to analyze her smile and create a model, the design of the new smile in the digitally. We would like to apply this to patient as a mock-up, which is the trial of the smile. During the temporary phase, the patient can use temporaries as a final smile and can tell her idea for us. And then on the next stage, right after 1 week, after the healing process, the patient came to our clinic. We carefully remove these upper 6 zirconia crowns, and then we apply rest of the teeth ultra-light tooth preparation. Because for zirconia crowns, you need to drill teeth all the way down 360 degree, and this drilling should be aggressive because every material in dentistry has their own properties. So for zirconia crown, at least the thickness of the material should be 2 mm. This means that you need to file the teeth at least 2 mm from the every angulation. But for Emax veneers, sometimes we don't need to even prep the teeth, like to drill the teeth. Sometimes the nature makes this drilling for us, or like the abrasion. In some cases, when the teeth are not visible, so we need to support tissues around, we don't need to also apply a preparation on the natural tooth surface. This is that we take our notes, we direct to our ceramist, and then we started to laboratory phase, which is production of the veneers. So the veneers, Emax veneers, are ultra thin porcelain shells we are applying on the tooth surface. But this upper 6 zirconia was already crown made. So my solution here was to make this upper 6 Emax veneers. Imagine a veneer 360 but slightly thicker than how it should be. The idea of this, when you compare zirconia with the Emax crowns has more lighter than the zirconia crowns because zirconia has their own weight. This gives the patients that they have something artificial. Doesn't matter, even in the mouth, it can look natural, but as a feeling on the user or patient, they have always feeling that they have something superficial and artificial. With the Emax veneers, this is more easier because the material is light and the sensors in the mouth accepting it more easily. And then after we apply regarding on the patient, and she said like, I want to enlarge my buccal corridor, which is how it has to be. So we apply 12 units of ultra-thin porcelain veneers on the upper and 12 on the lower. Basically, totally with 24 units of ultra-thin Emax veneers. As you can see here, we achieve this natural result. And the patient reservoir was looking white but natural. And then we also added some transparencies on the edges because this was the patient request. Because most of the people think once you have this transparency, the teeth looks natural. So to give them a psychological relaxation about the smile, we like to listen them how natural smile would be from your side, and then what we can give to you. And here is the result with the 24 units of veneers with a beautiful smile. Even on the first appointment, like when we saw her on the mirror, she said like, I was not even expecting this much beautiful, and she was smiling confidently.